My name is Tran. I'm a cataract surgeon and refractive surgeon in Southern California. I've been in practice for over 20 years, and most of those years were in Southern California or are in Southern California. I specialize in refractive surgery and cataract refractive surgery, so my goal is try to not just get the vision clearer, but try to get patient to be as independent of spectacle as possible. The Lenstec's ClearView3 is a pretty interesting lens in its own unique category. So as you know, presbyopia correction is important to the cataract patients. And the lens provides excellent distant vision, excellent near vision, without much compromise to the quality of the vision. The fact that the lens do not have concentric rings and does not have much of the halos and glares that we've seen with typical diffractive optics design. In my own experience, I've been very happy with them. The quality of the vision is excellent, and patients are able to see both distant and near for the most part as they expected. So this is the first time it's my experience with the Lenstec with basically presbyopia correction without any rings or any diffractive optics. The result are pretty much what we're expecting. The near vision is good, the distant vision is good, and patients are happy with them. They come in, they expect a certain ability to be able to be spectacle-free for distant, intermediate, and near. And so far, all the cases that we've done so far, patients were able to achieve that. I've been using the ClearView3 for about a year. Initially, because we have a pretty significant cataract and refractive surgery practice in Southern California. So Lenstec approached us about the lens and asked us about using them, and we did, and the results are spectacular. I love them. So since then we've been using them. I don't have any patient that complaining of halos and glares, not just yet anyway, for the volume that we've been doing, which is pretty good because for most other lenses, by the time we've been doing it for this long, we would have some complaint. So I'm sure with any other lenses, there will be some patients that have complaints of halos and glares, even with monofocal lens. But so far, my experience is really good with it. As we know, most of the intraocular lenses out there come in half a diopter increment. And to be able to get the corrective power right on target, having a quarter diopter increment is really helpful. Our diagnostic technology are much more precise now, allow us to choose lens much better than it was a couple of decades ago. The process of implanting the lens is fairly simple. It's just very similar to any other cataract surgery that you usually do. During the injection process, the only difference is you kind of have to watch out the orientation of the lens as it comes out. There's a kind of a landmark on the haptics of the lens so that you can watch it rather than just inject it in and expecting it can orient in any direction. So it's just watching the orientation a little bit, and once it's in and it's in the right location, then that's pretty simple, very similar to all the other cases that you do. So presbyopia corrections in cataract surgery is a little bit of science and arts combined together. And every patient, is a little different. Some patient looking for more near vision, some patient looking for more of a distant, clearly vision without any aberration at night. What I usually do is assess the patient first and find out what their needs are. And once they find out what their needs are, and if the Lenstec is the one that matching their needs the most, I would introduce that lens to the patient. For the doctors who have not done presbyopia correction before, then starting with this lens is not a bad choice at all. You just have to follow the process of managing the refractive outcome, the astigmatism management, and also make sure that all the macular pathology and so on are not there. And I would speak to other colleagues who have done presbyopia correction and look at some of the nuances that you have to deal with. But for someone who've done presbyopia correction with lenses for a while, the process is very easy.